What time did we get out of here? 12?
Yeah, I think we get out around 12.
Okay.
But we need to blaze through the next two. Okay, so next lecture is going to be on neoplasia, which is cancer. Yeah. So just briefly an overview: cancer disorders, altered cell differentiation and growth, and the resulting process called neoplasia. Neo meaning new, plasia meaning cell growth, and so you have new cell growth. And what you're really referring to is just how cells keep replicating. It's uncontrolled cell replication, and they become problematic to surrounding organs and other things. So as far as statistics go, you can kind of read through these, but it's a major problem, right? I don't think I need to convince anyone that cancer is a problem in the world or in America, right? This kind of a brief chart that goes over the different sex differences. Obviously, more women get breast cancer and only men get prostate cancer. But this kind of breaks down the different percentages of cancer exposure. I think it's in America. I don't think that's worldwide. But yeah, cancer is a major problem in the world, and a major problem that y'all are probably going to be exposed to as healthcare providers. So outline, we're going to talk about some of the background and nomenclature of cancers, and then we'll go into differentiating benign tumors and malignant tumors, and then we will go into cell differentiation, death, different metastasis, which is just the cancer moving to other areas of the body than where it was originated. And then we'll talk about the etiology of cancers, some clinical manifestations, and briefly go over diagnostics and treatments. We won't go into that too much in detail. So when we talk about the history of cancer, it's been described even over 3,000 years ago. So it's an ancient condition that has probably plagued people for a significant amount of time. And you got to realize back then, like, skin cancers were probably like insane because you just didn't have the protection from the UV as far as clothing, being indoors, and things like sunscreen, obviously, that like you just don't have back then. So probably skin cancers were probably crazy, which it probably contributes to increased amounts of cancers back then. But cancer is still a problem, but for another reason still today. And the word itself comes from Greek, even way back then, 300 to 400 BC. The word carcinoma was around insofar as carcinoma means crab. And I think what they're referring to is that as cells grow and divide as clumps, they look like little pointed crab-like pincers, and so it looks like they're just like extending outward into other areas, and so they call them carcinomas, but it means crab in Greek. Finger-like spreading projections. This is a statue of Hippocrates, who is a big medical person in Greek. So specifically, a lecture that I did have to get rid of was going over all these differences right here, where it's different types of cell changes. And so this is going to be the only exposure that you're going to have here, but it's not the end of the world. But what you can see is that there's different ways that cells change in a person's body. So if you have normal looking cells, if cells atrophy, that means they shrink and get smaller. And this is things like, you can imagine bone density. If you start losing bone cells or they start getting smaller, you don't have the toughness, and so your bones will atrophy. You also have muscular atrophy as well, where your muscle cells get weaker over time. So that's just your cells decreasing in size. You have hyperplasia, where they increase in cell number. This is something that happens a lot when a whole bunch. If you have alcoholics who drink a lot, they have increased numbers of liver cells to deal with that increased amount of alcohol that is poisoning their bodies. You have also dysplasia, where you have disorganized cell growth. They morph and they just look strange and have different molecular patterns that are not normal. You have hypertrophy, which is getting bigger. That could be a good thing, even like your cells hypertrophy whenever you work out, right, to support the increased demands of of, like, if you're a consistent runner, right? You start running a 5K, and so you're training every single day. You want your muscles to get bigger and stronger so they can push you through that increased demands that you're doing relative to what you were doing before, right? And metaplasia is where they change in cell types. So a good example of this is if you have repeated gastric reflux, where you are consuming something and then like your stomach's producing acid, but then it's producing so much because you're eating so fast that the acid actually goes up through your esophagus back up towards your mouth. It's acid reflux, right? So it's refluxing back to the opening. Well, what'll happen is because the esophagus, which is not supposed to be exposed to acid, is being exposed to acid on a consistent basis, your esophagus, like right by your stomach, your esophagus cells will start turning into what your stomach cells look like. And it's because you're shifting and because your cells are like, oh, I'm supposed to be exposed to this acid so much because you have so much acid reflux that your cells are actually changing in the type, and that they're becoming like stomach cells when they're supposed to be esophagus cells. So that's metaplasia. Now, metaplasia can actually develop further because you're changing cell types and you can dysregulate the regulation of the cell biology itself. That can actually turn into neoplasia, which is which you're generating new cells in a manner that's not supposed to be, that's supposed to be suppressed. And so that is the precursor for cancers, obviously, where you're having increased cell growth that is starting to become unregulated. So if that develops further and further and further, you get cancer, development of even more aggressive cancers, and then you can have things like metastasis and stuff like that, where these just cancers become so bad and it can eventually kill people, right? So, not necessarily. So, benign tumors are still going to be neoplasias. Yeah. We'll talk about that in a little bit, though. Good question, though. I forget what an example of dysplasia might be. I think it's stuff like there's some mouth conditions that have dysplasia where you have like gum problems. I forget. There's probably 1,000 examples that I'm not thinking of. Okay, so for definitions, we have a whole bunch of definitions here that you'll be. I'm not going to like test you on the technicalities of the difference between a cancer and a tumor and a neoplasm, but I want y'all to know as I'm talking what I'm referring to. So, right, neoplasm is new growth, uncontrolled proliferation. Tumors are a lump or a swelling, right? We saw that in the genetic disorders lecture. Also, often synonymous with neoplasm. A cancer is a malignant neoplasm or a tumor that is or a tumor. In situ versus invasive cancer. So in situ means in the same place, where if you have an in situ tumor, that just means wherever the tumor originated, that's where it is right now. You don't have any metastasis. But you also have invasive cancers where you can see a picture here where you have this like lining, right? You have like a separation of your organs, right? You have your heart and your lungs and your kidney, right? Well, if you start growing something in your heart, your lungs are right there. If it like, for example, I don't think this happens very much, but if a tumor grows on your heart and it pushes and then it invades the lungs, which is right next door, that's an invasive tumor. It is no longer in situ, right? So in situ is going to be staying above whatever the lining separation is between the two organs, but if it crosses that lining, it's invasive. And then obviously, if it straight up moves, it detaches and then moves from breast to your lung, for example, then it's going to be a straight up metastasis, and that is also a non in situ classification of a cancer. Yeah, so there you go, invasive and metastasis. Cool. So a neoplasia is where cells don't die off, right? Apoptosis we talked about. And so what this is that normally you have cell proliferation, right? Your body wants to grow. It wants to grow to a certain cell density until the organ is saturated with cells, and then it stops growing, right? Importantly, it stops dividing, or it continues to divide. This happens a ton with your liver. It continues to divide because the cells are dying off, right? And so if a liver cell becomes overwhelmed and is already detoxified as much as it can, what it'll do is it'll induce self-death kill off itself, and then a new cell will come in and divide and then replace it. And that's just a normal, healthy thing to occur. The problem is with neoplasias is that they are dividing but aren't controlled to where they replace that dead cell, but then they keep dividing, and it's unregulated, right? So it can be either benign or malignant. Benign is where there's a lot of conditions where you have a benign tumor, but that's less harmful, right? It's not going to cause as many problems because it's not as aggressive, it's not invading, and it's being relatively controlled, but it started off as an uncontrolled cell growth. That's how it got to be a neoplasia. But with a malignant tumor, those are dangerous, right? Those are invading tissues, messing with your normal physiology and causing death and all kinds of problems, right? Cells do not mature normally and differentiate do the job the tissue is supposed to do, right? And cells are difficult to recognize as their cell of origin. So what will happen is that you progress into neoplasia. So whether you're benign or malignant neoplasia, they can acquire increasingly aggressive features, and we're going to talk about some of these features that are associated with cancers and some of the changes that need to occur with cells. But it's due to a series of random mutations that occur, and people will have a different propensity genetically for acquiring these mutations and not. It's very intricate. We're just going to be generally talking about cancers, nothing specific or really to the depth of you need a whole course on this to really get into all the ins and outs of it. But yeah, there's pre-neoplastic conditions that then get worse and worse until they develop into tumors and then cancers and then aggressive cancers and stuff like that. So you can see here is that there's different, there's a progression. So you start off as a normal cell, you get mild dysplasia. So dysplasia can form into a neoplasia, but once it crosses that barrier, it's not a dysplasia dysplasia is not a cancer until it goes into neoplasia, where you shift that classification. So you start off with dysplasia, and then you can develop more and more, and then you eventually get into invasive carcinomas, where carcinomas develop, they can invade, and then they can that's when you cause problems. And this is a really good example of cervical cancers that develop, which is mostly the result of viral infections, because these viruses contain oncogenic properties that can cause cervical cancer in women. HPV, you might have heard of. I'm sure all of y'all. I'm kind of preaching to the choir here, aren't I? Right. So the first thing we're going to talk about is benign versus malignant tumors, and there's a whole bunch of differences between the two. So you can see here that with a benign tumor, what you'll see generally speaking is that it is less aggressive. It is walled off by the immune system most of the time. So you can see here that this picture has a barrier right here, right? With the benign tumor, that's like the immune system coming in and controlling it to a certain degree, where they're putting like a capsule around the uncontrolled cell growth. And what's great about these, you can just come in, cut them off, and then they stop because it's just normal cells all around them, right? So they're less aggressive. They're non-invasive, but so with the malignant tumor, right, there's not that capsule, there's not that control. So they're just invading where the normal cells were, taking over, growing uncontrollably. And then if they continue on that course, they can invade the tissues around them. And then if they continually get worse and worse and worse, they eventually can go, they can metastasize and then get to other areas of the body where they're going to control, where they're going to grow, where they're going to continue to grow and cause even problems to other areas of the body. So while you're studying, most of like what I just said, it covers all of these. I'm not going to read this whole list, but while you're studying, be responsible for this and just kind of develop the intuition about what the difference is benign and malignant. It makes sense, right? Anytime I'm like, this is aggressive, right? It's going to be malignant, or this is not aggressive, it's benign, right? I'm going to try to make this as obvious as I can for testing purposes, but make sure to go over this chart. All right, so yeah, another thing with benign tumors, they have different names with malignant and benign as a rule, but there are exceptions to this rule importantly. But for the most part, if it's a benign tumor, it's just going to have whatever the cell type is, morphological characteristics, and then just in an OMA. So a good example here is a squamous epithelial tumors, epithelioma, right? So the cell type is an epithelial cell, and it's an oma, right? Or an adenoma of the adenoid glands, right? But with a malignant tumor, right, it's going to end in carcinoma or sarcoma. So adenocarcinoma is going to be a malignant tumor. So it ends with that. One of the more nerdy parts about myself is in biology, they have to generate antibodies, what they'll do is they'll fuse a B cell, which makes antibodies, with a cancer cell. And they'll fuse those and make a hybrid cell that is cancerous. And so it lives forever, but it's constantly producing antibodies. And why that's good is because if you're like a company trying to sell antibodies, you can just have one cell line that just lives forever and then will constantly produce product that you can sell. And then you just isolate the antibodies. And they call it's a hybrid cell that grows forever. So they call it a hybridoma. But so my Instagram handle is like super nerdy, and it's hybridoma because like my last name is Doma. It's like, yeah, I went hard in undergrad. But at the end of the day, it's that same classification of a benign tumor. They're just putting oma at the end of a hybrid cell, right? Hybridoma. There are some exceptions to this. So Hodgkin's lymphoma, it ends with OMA. These are very malignant. And we'll talk about Hodgkin's lymphomas later on in the semester. But these are cancers of your lymphoid organs, your lymphatics. Okay, so more benign versus malignant. The majority of neoplasms can be categorized clinically and morphologically into either benign or malignant on the basis of certain characteristics. So characteristics of the tumor cell, the rate of growth, the local invasion, and the ability to metastasize. So you can see here a really good picture of the differences here. You can see here that this is invading, growing uncontrollably. It's got very much uncharacterized borders. So that's a big way to differentiate cancers being benign, or skin tumors being benign or malignant. Is that like if it's just like a circle, looks like a big freckle, they're usually benign because it's like perfectly spherical. But if they have really irregular borders, they're more malignant and they're more problematic and more important to remove. And then you can see here there's this little capsule around it, like we said before with benign. Now, this is important. So there's macroscopic and microscopic differences between the cells. So what I want y'all to be very careful with when y'all are studying is recognize that macroscopic features are about a population of cells. So you can see the crab-like extensions, ill-defined borders, and lack of a capsule. Those are all looking at the collection of cells as a whole. Now, this differentiates from microscopic features where you have abnormal cell size. It's about the cell specifically, one cell, right? Where you have abnormal cell size or shape, right? Abnormal tissue architecture and histological staining abnormalities. You also see different biochemical differences, right? Like certain pathways are activated that we'll talk about later. There's like chemical inside the cell. There's chemical differences between cancers, benign cancers and malignant cancers. Now, I think I point this out because I think one of the test questions themselves are, which of the following is a macroscopic feature, or something like this. I'm making this up, but which of the following are a macroscopic feature and has these three and then like one of these? And you have to realize that this is a microscopic figure because all of them are going to be like associated with cancers, but it's just one's microscopic, one's macroscopic. I don't want y'all to miss this. Now, with that being said, we're really beating a dead horse here. So differentiated cells mutate, they differentiate and they can become benign tumors. So what I'm saying here is that with differentiated cells, what'll happen is that if you're fully differentiated, you're toward the end of your differentiation capabilities. Those typically form more benign tumors and become less harmful. And the way you can kind of think about this is if you're undifferentiated, meaning like you're like closer to being a stem cell than you are being a liver cell, like there's this like characteristic progression of development. If you're closer to being toward the end of that developmental scale to the beginning, in the beginning, you want cells to divide, right? Because you want one stem cell to become a whole organ, right? So you want to divide a lot and then develop accordingly. If you're closer to that like ability to divide, well, that's going to be a lot easier for a cancer to come in, change one or two things because it's already rapidly dividing. You just got to change one or two things to become uncontrolled, and then you're good to go as a cancer. But if you are toward the end of it, these cells have to go back and then say, oh, I'm not rapidly dividing anymore. I need to turn on those genes, and I need to turn on the uncontrollable part, right? And so it's a lot harder for differentiated cells to become malignant, or at least dangerous. They're more benign in that they replicated, but then they were controlled a little bit. But that contrasts to these things called anaplastic, which means to form backwards. And what's happening there is that these specialized differentiated cells are going backwards. They're taking this progression timeline and they are going backwards to it to becoming more stem cell-like. So they're turning on the ability to grow more, and then they can easily become more cancerous because of that. So there's this anaplastic term, but I won't test y'all on that. Regardless, at the end of the day, these things are more aggressive whenever they're growing more rapidly, and that's just correlates. All right, so we're going to talk about some of the things that happen within a cell that cause cells to become more cancerous. And the first thing is these things called, have you all heard of these cyclins and checkpoints? And cyclin-dependent kinases you might have heard of, or CDKs. What these are that your cell divides, right? It goes through mitosis and then the rest of the replicative cycle, where you go to G1, which is the growth 1 phase, where the cell grows a little bit. You go through S phase, where your DNA replicates so that each cell has the proper amount of DNA. G2, you finish growing, and then it divides into two daughter cells, right? Well, there's certain checkpoints along this cycle, right? It grows for a lot, and then it checks right here. Okay, did we grow enough to support DNA replication? And then once it says, yes, we did grow enough to support DNA replication, it progresses into DNA replication. It's very careful. The cell biology is very careful about controlling cell growth. And part of that is to avoid cancers, right? So what happens in cancers, obviously, is that these checkpoints are unregulated. And we'll talk about one specifically later, but these checkpoints are unregulated to where it just blows past it. It'll just go into DNA replication without really checking to make sure it's good to go. And so what will happen is that it'll just go into S phase and it'll blow past G2 and blow into S phase and it'll just divide, right? It's not necessarily good metabolically or whatever, but it just figures it out and then it just divides and is uncontrolled, right? Because you're not checking to make sure you're good to go for everything. And so by dysregulating the cell cycle, you have cancers that pop up because they're just uncontrolled cell growth, right? You have increased mitotic index, that just means it's dividing more, and decreased amount of time for mitosis, so it's dividing faster. We'll talk about later is that these cancer cells obviously are metabolically super active, that they consume a lot of energy to divide and go through this cell. And what will happen with patients is that cancer patients lose a ton of weight, and we'll talk about that later. So yeah, cancers blow past these checkpoints and often get rid of them. They just mutate them away. So there's a lot of other changes to cells in cancers. So we'll talk about 3 examples on the cell biology side and then a couple of non-cell biology sides. So this is a chart of the percentage of mutated genes in cancers. And what you can see is the first 2 are TP53 and PI3KCA. And we're going to talk about both of these specifically on these next slides. So what TP53 is, or you might have heard the protein P53, or a very similar protein which is called retinoblastoma, are RB. So P53 and RB. What both of these are they are checkpoints that stop cells from dividing. And so what they are generally classified as is tumor suppressors. So obviously because they're stopping cell division, they are suppressing tumor growth in an efficient manner. And these are so important to these checkpoints that these are straight up oncogenes insofar as if these are mutated away, if these are either gotten rid of or mutated to where they don't function properly, that's the number one cardinal sign. RB and P53 mutations are like the number one most mutated genes in biology. And because they control these checkpoints and they are tumor suppressor proteins. Now, what they do specifically is complicated. There's like tons and tons of research on this about what they do. They do a lot of stuff even in controlling DNA replication and checkpoints and all kinds of stuff. So we're not going to go into all those, but what I want y'all to know is that that P53 and RB are both tumor suppressors, and they function as checkpoints for that cell division, like we talked about a couple slides ago. And they're the number one most mutated gene in biology. The second most mutated gene is a part of a pathway called the PI3K AKT mTOR. Well, some people say mTOR or not. This is a pathway that I personally used to study and I've published on. And what happens is that growth factors, when you have a normal, healthy dividing cell, and this will happen like for that liver cell, for example, right? If you have a cell die and then it needs to be filled in to like replace that dead cell, what will happen is that your body will tell the cell, it'll have these different growth factors that trigger these growth factor receptors, and then it will trigger this protein called PI3K, phosphoinositol 3 kinase is what it stands for. And PI3K, it is a kinase that will then phosphorylate a protein downstream, or is actually it phosphorylates these lipids downstream. But at the end of the day, PI3K, what it does is it results in the activation of a protein called AKT, which non-intuitively doesn't stand for anything. And what AKT does is it tells the cell to survive, first of all, and then use energy to replicate. So 3 things. So survive, use energy, and replicate. Well, obviously, if you're a cancer cell, you want to survive. You don't want to be induced cell death. You want to use a ton of energy so that you can replicate, and you want to reproduce, right? And you want to go through mitosis. So because this pathway, and there's an additional protein called PTIN that's also in the top 10 of most mutated genes in cancers that are part of this pathway as well, that this pathway is the most mutated pathway in cancer biology to be that's associated with tumor progression as well. There's also mutated versions, PI3K, that's always on. Yeah, so what cancers do is that they turn on this PI3K, and that, when we go back to this chart right here, this PIK3CA gene that codes for this PI3K protein. That is, it always turns this on. So because PI3K is always turned on, AKT is always turned on, and because AKT is turned on always, you have increased metabolism, survival, and reproduction, right? And the last cell biology thing we're going to talk about is this concept called telomeres. Have y'all heard of this before? Yeah. Telomeres are these protective endings on DNA, and there's an enzyme that puts these on called telomerase, and it extends the because there's a problem with linear DNA replication that each time it replicates, it misses like a few base pairs, which sounds pretty innocuous, but over the course of a lifetime, these things can significantly be degraded. So much so by the time that people are generally like 25 to 30, they've completely chewed back all their telomeres, and they're starting to actually chew back significant chunks of DNA. It doesn't usually become a problem until you reach your 70s, 80s, and 90s, though. So it's like a normal lifespan thing, but yeah, this is like a major problem. There's like anti-aging people that are trying to express telomerase in a higher capability in humans, and they're hoping that can reverse some of the effects of aging. But what cancer cells will do is that obviously if you're an overactive cancer cell, these cancer cells are going to chew back these telomeres at a faster rate. And so so what cancer cells will do is it'll upregulate this telomerase enzyme, turn on that, extend that telomere into where it can divide more rapidly. And it leads to immortality of the cancer cells. And that's why, and that can be taken advantage of when you're a company that's trying to produce those antibodies and you're fusing these B cells to an immortal cell line, but are very problematic in human biology with regard to development of these cancers, right? So another thing that cancers, and it's just the crazy part about cancers is how robustly they take over their little replication machinery. It's like every little way that you can think of that supports biology, they manipulate to support themselves, right? And so another thing is this concept called VEGF, vascular endothelial growth factor. And what that does is it recruits blood supply to a specific area. So this is something normally like if you get a cut, you just cut a whole bunch of blood vessels, your body will secrete this VEGF to repair those blood vessels so that all your tissues get the proper amount of blood supply, nutrition, oxygen supply to live and thrive. Well, what happened is that these cancers, because they're growing so aggressively, the internal of the cancer cells will stop dividing as much because they don't have access to all that nutrition and oxygen, right? Well, actually, they don't need oxygen, but nutrition specifically. What these tumors will do is they'll secrete this VEGF and recruit in this blood supply. And so the new blood supply will come in, feed these tumor cells to where they can still grow and they still have a ton of nutrition availability, even though theoretically they shouldn't have the blood supply to do that. Does that make sense? So it's like it's just another way that these cancers just uncontrollably grow. And this kind of brings up this chart right here where what this chart is showing is the amount of cell cycles that happens before a cell truly becomes detectable. So what you can see is that, and you got to remember, this is one cell dividing into two. So this is like an exponential here. So this is 2 to the 5th right here, which is 2 times 2 times 2 times 2, which is like whatever. But like when you get to 2 to the 20, that's like a lot of cells, right? And you can see here that you're still not even detectable. You don't become detectable until you reach about 1 billion cells in a tumor. So this malignant cell is divided 20 times and isn't even started to really appear in any manifest way. It doesn't take to where you're divided about 30 times to where you can get to 1 billion cells, in which case that's just a lot of growth that can occur of that cell before it becomes detectable. And then obviously there's certain organs like your skin cancers you can detect really easily because you're looking at your skin on a constant basis. But when you talk about things like the pancreas, it can just grow to 50 cycles or whatever to where it's like it just blows past a lot of stuff before it becomes noticeable. But yeah, so that's a major problem as well. But yeah, this VEGF factor is another thing that supports tumor cell growth. Now, another thing is that the immune system itself should be regulating cancers, and it does on a regular basis. There's tumors that pop up all the time on a single cell basis that don't even reach the 2 to the 5th thing. And your body, thing is, your immune system recognizes that tumor and just destroys it before it ever becomes even remotely a problem, right? And so your immune system is really important for this stuff. So another thing that cancers have to do is that they have to evade immune systems. And this is some really cool research this lady named Carolyn Bertozzi performed. She works at the University of Stanford, and she works on how cancers evade the immune systems. And what she found was that that there's these carbohydrates on the outside of cells called sialic acids that are upregulated cancers. And what these sugars do is they turn off the immune system. And so if you're cancer and you see a patrolling immune cell come along, you want to tell the immune system to turn itself off so that the immune cell doesn't kill you, right? So you can survive and reproduce more. And so this is like one of the ways that this lady, she won the Nobel Prize 2 years ago, she discovered does, and it's starting to revolutionize not only cancer fields but other areas of pathology as well. There's a separate way called major histocompatibility complexes. Have y'all heard of this? MHCs. Yeah, so what this is, it's kind of the same thing where MHCs, it's complicated, but simply put, they also turn off the immune system. So if you can regulate, so immune cells can be regulated by cancers through this other protein complex as well. So yeah, the immune system is also something that has to be regulated. It's every little thing, right? It's not only growth, not only cell biology, but also immunology and a whole bunch of other stuff that we're not going to go into. All right, so we'll try to breeze through this. So as far as the causes of cancers, there's genetic components and there's external factors, right? People that have certain genetic propensities for BRCA genes, right, that you might have heard of, have exposures to breast cancers at a higher rate. But then also, and that's just a genetic thing that you can't really control because it's your genetics. And then there's also people who smoke cigarettes and get lung cancer, right? Where they just have, that's an external factor that they can relatively control. Okay.
Bruh, hell no.
Oh, yeah. Okay. Anyway, right, you can relatively control. She'd have a spit cup.
I know.
Oh shit! Yeah, people do that. I don't know.
Not in class. Wait till we get out of class.
I was I just bought a new truck and the salesman was different right in front of me and it was gross. He was like just using a spit cup. I was like, bro, do it afterward. Yeah. And my papa used to dip all the time. Yeah, it's not a pretty fact. Whatever. But yeah, you can control those decisions because I think dipping also causes mouth cancers. But you can control the decision to dip or smoke or do whatever you want, right? So it's an external environmental agent that contributes to cancer development. So there are cancer-associated genes. We talked briefly about some of them, RB and P53. There's other ones, HER2, these new genes. You don't have to know those, but there's this concept of the Philadelphia chromosome as well, which has like really cool clinical stuff, but we won't go into that. But yeah, we talked about briefly those tumor suppressor genes P53 and RB that need to be changed to for these tumors to progress, right? And then there's also proto-oncogenes which support. So this is like two categories, right? There's the proto-oncogenes which support cell growth, and then there's the tumor suppressor genes that need to be turned off that stop cell growth, right? So what we'll learn, and you'll see a slide on it later, is that tumors need to turn on proto-oncogenes so that supports cell growth, and they need to turn off tumor suppressor genes so that it'll also support. You're stopping something that stops you, and you're promoting something that promotes you, right? And both of those will lead to cancer development. Regulating cell growth. So we talked about this, lack of density-dependent contact inhibition. So this is something that y'all can unbold that even. I won't ask about that. But yeah, this is a lot of the same stuff. That there's just environments that support malignant tumors to being more aggressive. As a malignant tumor grows, they will secrete enzymes that break down proteins and contribute to the infiltration invasion, right? So there's these proteins and these layers between organs that separate the two different organs, right? Well, if you're going to invade an organ to make room for yourself, you need to break down those barriers and these walls that are like trying to hold you in a little bit. And so these malignant tumors will also break down proteins so that they can invade as well. And this invasion of different organs that usually precedes metastasis, insofar as metastasis is like is a further stage that if you're going to move to a different area of the body, you've already usually invaded your surrounding organs. But benign tumors won't do that, obviously. So when we talk about metastasis, what this is the movement of cancerous cells through the bloodstream, right, into organs. into different organs. And so typically you need these kind of highways, whether you're the lymphatic system or the bloodstream, to get to other areas of the body. It's not typically considered metastasis if you've just invaded a neighboring organ, right? And so what'll happen is that a cancer cell will pop out of where it was at, and it will move through the bloodstream to a different area and then seed itself in another area. And what's important to note here is that breast to lung metastasis is a very common example where if you're a breast cell that's cancerous and you've moved to the lung, that's still a breast cell, right? It's not like a lung cell that is cancerous now. So these are called secondary breast cancers rather than lung cancer, if that makes sense. Does that make sense? That like it's not changing the cell type just because it's in a new environment. It's still that same cell type. So it still has the same name as the primary cancer where it came from, where it originated. And so what's interesting to note, and I didn't know before I read this textbook, was that different cancers, and it makes total sense, is that so if you originated from a specific area, there's different tropism, meaning like, do you know what tropism means? I don't know. Maybe not. It's like your ability to move to a specific area of the body. So different cancers have different tropism, meaning if you're a breast cancer cell, for example, you don't just like disperse equally and can grow anywhere in the body. They actually specifically target certain organs to develop those secondary cancers. So, and the reason why is because you can imagine that if you're a brain cell, you're going to have different nutrition requirements, different exposure to oxygen, different, like there's that blood-brain barrier that really protects the brain, right? So if you're a breast cancer cell, you might not necessarily be able to survive and meet all the nutritional requirements you need to replicate and develop a secondary cancer. So what happens is these cancer cells, they try to go to the brain, but then they just don't succeed. They'll implant and then they'll die, and then it's like one cell and you never even notice it. But the lungs, for example, that's a really great environment for breast cancer cells. So what they'll do is they'll move to the lungs and then plant, and then recognize this is a great area for me to divide, and they'll develop secondary cancers. So what'll happen is different organ, depending on where the cancer originated and where it went, it has different like tropism. So why that's important clinically is that if you are trying to look, does a patient who has breast cancer, has it metastasized yet? You can look at very targeted areas. You can look at the lung and see, we don't see any breast cancer cells in the lung yet, so it hasn't metastasized. You don't have to look at every single little organ of the body to see metastasis. Does that make sense? So yeah, it's a good little trick that healthcare providers use. Organotropism. Oh, there you go. So this is just a review. Y'all can read this. We're not going to go over this. It's just a little practice question to make sure y'all are alive. So an experimental cancer therapy is targeting the production of telomerase in cancer cells to control the progression of breast cancer. Cancer cells production of telomerase mediate what? Not cell. So cell proliferation would be like cell division. So cell differentiate is kind of the same. One of them. So when we talk about telomerase, what does telomerase do? Yeah, it'd be B, right? Yeah, so that's what makes cancers immortal, right? Is the expression of telomerase. Very good. Third time's the charm. Yeah, so this is kind of an example of what test questions would be similar to, that you just kind of have to learn the information and kind of just pick out.
Don't judge us today. We're barely alive.
Yeah, I mean, it's the first day of the semester. Yeah, they're still waking up for brain cells.
Literally.
It's an exhausting course. Yeah. Okay, so stages. So there's different stages of oncogenesis. So the first being the development of the tumor, then it becomes carcinogenic, and then you initiate different mutations, and these mutations will start to do things like mutate that P53 or RB, or mutate that PI3K or AKT, and then to where you're promoting development of the cancer. So there's promotion, where these mutated cells are starting to divide. You're starting to take advantage of those mutations that were just made if you're a cancer cell, and then it progresses further to where they compete with one another. Whatever the strongest mutation is will survive. This is just like natural selection, and they'll develop more mutations. There's even cancers that will mutate genes that mutate DNA. So where it's like they're hypermutated things, and it's every little way you can think of, and it just becomes more aggressive after you do that. Right. So there's different things that contribute to the development of cancer. There's your genetics, there's hormones, there's obesity, chemical carcinogens, radiation, there's virus and bacteria like HPV that we talked about. So all of them contribute to this cancer development. You won't need to know like a list of these things though, because it's so much. This is the slide I was kind of referring to earlier, that for cancer to occur, you need to mutate genes that activate proto-oncogenes to oncogenes. So you're mutating genes that support cell division, and you need to inactivate tumor suppressor genes. And all tumors that develop, they need to do both, right? Doing one of these things isn't enough. And this is absolutely a test question. That's why I'm trying to emphasize this as much as I can. All right, so there's a couple other side effects. I mean, obviously, maybe that anyone who's been exposed to cancer patients has seen this kind of stuff. There's a lot of pain. They're very, very tired because they're just running out of energy. What cancers do is they direct all the energy toward cancers, and they use a ton of that energy, and so you don't have any energy to like be normal and like awake. So you're very, very sleepy all the time. The cancers just consume so much energy, so these cancer patients lose a ton of weight. My dad had cancer like 2 or 3 years ago, and he recovered from it, and he's in remission now. But he got this cancer right before he started a diet. Like he was like dieting to be like more healthy, and he was losing like a ton of weight, and it was like, this diet is really working. And then he didn't really realize what was going on, right? Because it became so, but he lost like 50 pounds in like 2 months or something. And then he started feeling some pain. So he went to the doctor, and then they found it and they started treatment. But yeah, it's just people lose a ton of weight. And if you see like late stage cancer patients, they're like rail thin, right? It's just eating them. Bozeman. Yeah. Panther, Black Panther. Yeah. He's super secret about it.
Talking so badly about his weight, but the whole time he was.
Yeah, it's a sad story. He's apparently a cool dude, so I feel for that dude. Yeah, it was cool what Marvel did with him though. Like how the second movie was just like a tribute to him. Yeah. It was cool. Yeah, he is a good actor too. Anyway, you have anemia as well, blood issues, and then obviously you have tissue-specific cancer. If you have cancer of the liver, right, your liver's not going to function normally, right? Yeah, okay, I kind of went over this. So you lose a ton of weight. So y'all know about aerobic versus anaerobic respiration. So aerobic generates a ton more energy per glucose molecule. You come in with oxygen and you break down, and that's the whole electron transport chain and stuff like that. That contrasts to anaerobic respiration, where you're pretty much just going through glycolysis, and you're only generating 2 ATP, net generation of 2 ATP per glucose molecule. What's interesting about cancer is that they only use anaerobic respiration, and there's a reason for that we won't go into, but because they're only getting 2 ATPs per glucose molecule, that's not and they're using so much energy to divide. It's just, that's why you consume so much energy. It's like the worst of both worlds in that more cells are being generated, and that consumes energy, but then they're also using an efficient means of metabolism to provide that energy, and it's just not a good situation, and that's why these people lose so much weight. And there's different diagnostic tools. We won't go over all of them specifically, but there's different tumor markers, tissue biopsies, immunohistochemistry. Yeah, I don't need to know that this much. Like, y'all could probably unbold that. if y'all want. Y'all don't need to memorize this list, I guess is what I'm saying. There's grading versus staging. Again, you probably won't need to know that for the test. But there's grading, which looks at microscopic examination, and then there's staging, which looks at macroscopic examination, the extensive spread, and the later stage. This is what staging is what people usually talk about. That I'm like a stage 4, blah 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 cancer. If you're to stage 4, that means it's metastasized and it's very very aggressive and it's very problematic. Yeah, so there's just different ways to classify this. Y'all don't need to know, because we're not going to talk about how to differentiate the different stages, so y'all don't need to, like, I'm not going to test on this as much. But y'all should know, like, this is a good summary of this, though, that, like, stage 0 is just abnormal cells. Stage 1, though, is cancer, but it's confined. Stage 2 is locally invasive. Stage 3 is it invades regional structures and causing problems, and then stage 4 is where you've metastasized and you've gone to distant sites. As far as cancer treatment goes, there's usually a combination of therapies. There's radiation and chemotherapy, surgery. You can come in and just cut things out, or biotherapies. The lady who discovered this whole sialic acid, this Carolyn Bertozzi lady who won the Nobel Prize, she actually developed an anti-cancer drug where it cleaves off those things that turn off the immune system, and it exposes the immune system back to the tumor cell. And that's really cool, because what you're doing is you're taking away the advantages that the cancers have, and you're just letting your immune system control tumors like they're supposed to. And it's really effective. It's starting to become like a regular treatment for certain cancers. Chemotherapy is really important. What it does is it tells cells to stop dividing, which is absolutely going to harm cancer cells. Problem with chemotherapy is it has pretty bad side effects, and these side effects actually make a lot of sense. When you look at what are the cells in your body that grow really quickly, do y'all know? Wait, what? Yeah, so skin cells are part of that. Not the fastest, but yeah, they're in the category. And so that's why you get really dry skin and rashes that develop when you have chemotherapy. Do y'all know what else? It divides really fast? What? Think of things that are exposed to harsh environments that might die a lot in your body. Highly acidic areas. Yeah. So your entire gastrointestinal lining is really fast dividing, so because it's exposed to such harsh environments that your body needs to constantly regenerate it. Well, another side effect of chemotherapy is that, is it on here? Increased risk of, yeah, it's not really on here, but you have like gastrointestinal problems and like stomach aches all the time whenever you're on chemotherapy. The whole alimentary canal is affected, right? You're constantly regenerating from so your alimentary canal is your whole digestive system from mouth to anus. But you also have increased risk of infections and hair loss. Your hair is really fast dividing as well, relatively speaking, and that's how you grow long hair, right? And so that's why you have hair loss. You're killing those cells that are dividing really fast. So the side effects are interesting, but they're all targeted toward stopping cells that are dividing, and that's why it's a good treatment for cancers. So that's about it for this. Any questions with regard to that? It's an interesting topic to like generally learn about because it's such like a problem, but it's scary, man. Cancers are like scary to me. Because like you can't really control it other than not smoking, you know. So I don't know. All right, so we'll take another 5-minute break. I'm gonna get this posted, and then we'll come back and finish up. Finish up quickly because I think we're starting to got 45 minutes. Well, I'm gonna post this online. Yeah.